Welcome to the Physician's Guide to Doctoring, a practical guide for practicing physicians. Dr. Bradley Block interviews experts in and out of medicine to find out everything we should have been learning while we were memorizing the Krebs cycle. The ideas expressed on this podcast are those of the interviewer and interviewee and do not represent those of our respective employers. And now, here's Dr. Bradley Block.
On today's episode, we speak to Dr. Christopher Burton, a physiatrist, public speaker, physician coach, and prolific author. He just published Burnout Breakthrough, a follow-up to Putting Out the Fire, both about physician burnout. We talk about the symptoms and consequences of burnout, reasons for burnout, what specialties tend to be the most commonly affected, and we finish with some high-yield ways to minimize burnout, like learning to love your EMR and following his legacy ladder to make sure your time is being devoted to living the life you want to live. Welcome back to the Physician's Guide to Doctoring. On today's episode, we have Dr. Christopher Burton, a physiatrist in Florida who is actually a prolific author and public speaker. And his latest book, Burnout Breakthrough, was recently released, and that's what we're going to be talking about today. So, Dr. Christopher Burton, thank you so much for being on the show today.
It's a pleasure. Thanks for inviting me.
So first, let's just talk about your training. Where'd you go to med school and residency?
Yeah, I was out in Southern California for both. I trained in Loma Linda University, not too far from San Bernardino and Riverside, Redlands, California area.
And then, what made you decide to write this book? What experiences have you had that led you to this breakthrough?
Yeah, that's a good question. I actually, it was kind of a culmination of things that led me down this road. First, when I started out, I was focused on leadership and communication for physicians. I did some coaching around the business side of medicine, how to market your practice, promote yourself in your specialty. But the more I talked with my fellow physicians, the more I realized that most of the problems we were addressing, they led back to being burned out. That someone would talk about, how do I, write a book? How do I, become a speaker? How do I undergo a career change? But the problem was, uh, they weren't necessarily going to those things because they were passionate about it, and some of them were, but a lot of the others were just tired of what they were doing already and were looking for a change. And so I realized that no matter what else I did, we were just kind of putting a band-aid on it, if you will. The real thing we needed to address was the fact that most physicians are burned out and are ready to do something about it.
So you mentioned it, that people would ask you how, because you were already a public speaker, how they could put themselves in the position that you were already in. So I definitely think it bears mentioning at this point that you're a prolific author. You've written books on physician finance, purchasing a home as a physician, marketing yourself as a physician, and this isn't even your first book on burnout. Your first book was Putting Out the Fire: How to Prevent Physician Burnout. So, so this is a topic that you're revisiting. Why do you think, if you'd already had a book on it, why do you think it was necessary to revisit the issue?
I think as I finished the first one and got it out there in the hands of more and more physicians, I realized that prevention was one thing, but I mean, let's face it, we're already busy. How much time do we spend on prevention, even with our patients or as patients? How much do we spend on doing our own preventative maintenance versus when things are already bad? That you're looking for a solution. Very few patients come in and say, I'd like to eat better, exercise more, lose weight. They come in because they've got hypertension, they've got diabetes, their joints hurt. They're already feeling the pain, and that's the way. Kind of one of the analogies someone else told me a few years back was, people will, they come to you for the pain medicine. They don't come to you for the vitamin. So I thought, maybe I needed to explore it a little more depth, get some specific tips for people who are already burned out, and to see what they could do differently. So it's a little bit of a different take and a little deeper exploration of the topic.
So first let's define burnout. How is it that you define burnout? What are the symptoms and what are the consequences?
Yeah, burnout is, you know, overall, it's a lack of enjoyment in what you're doing, or specifically in your profession. Now, that's kind of the generic term or definition we use. And the symptoms, they start off pretty subtle. I mean, you might not even notice some of them at first. And that makes it hard to diagnose or quantify burnout for a lot of people. Um, think of things like cynicism or sarcasm, for example. That can actually be an early defense mechanism when administrators are pushing you, placing unrealistic demands on you. You don't feel like you have any say in how your schedule is going, how your clinics run, how whether you can hire or fire your staff. Even when you kind of start getting that cynicism or sarcasm, most people don't think of that necessarily as burnout, but it's kind of the first step down that road. Same thing with strained relationships at home. And it may seem like there's something else that's the problem initially, but then you realize that a lot of it has to do with kind of your attitude and the way that your judgment's clouded by the stress at work, or frankly even depression. And we start off, we feel exhausted, we feel physically and emotionally exhausted. We start doubting ourselves in clinic or in the operating room. Am I doing the right things? Am I making a difference anymore? And that again, that sense of personal accomplishment's not there. You don't feel like you're having an impact on the world, which ideally or not, that's kind of why most of us went into medicine, was to make a difference, because we wanted to help people and make an impact. To feel like you're not doing that, I mean, it feels like you wasted 12, 13, 14 years of your life to get to this point. Um, and again, the strained relationships, it can lead to things like divorce. Being estranged from your children. Some physicians are struggle with anger management difficulties, disruptive behavior. That's the dreaded label that you don't want, at the hospital or healthcare system. And just getting apathetic and not going through the motions, if you will. And your patients notice it. You start making mistakes more frequently. You don't have the same compassion or empathy you had when you started out. And some of the physicians, unfortunately, slide down that slippery slope into things like substance abuse, gambling, and sadly, even suicide has become a real problem for physicians. With over 400 physician suicides a year, that's over one a day that a physician's taking their life because they're so burnt out. So really, the consequences of ignoring burnout are quite serious. But despite the dire impact, it's just not receiving the attention that it needs. And when I say that, I don't mean that people aren't talking about burnout. I mean that they're not doing anything about burnout. You can read all the journals about the number of and the percentages and everything, but what I'd like to see, and what my book hopefully provides for physicians, is concrete steps that people can take to get rid of the burnout, to get out of that rut, as opposed to just, well, here, you're, don't feel bad, you're one of 50 or 60% of physicians in the US.
So one of the things that you mentioned in terms of ways to handle it is your legacy ladder. So I definitely want to talk about ways to manage burnout, but I want to first talk about the fact that it can start as early as residency, right? It can even start in medical school, and in residency it's a bit understandable, right? Like your schedule is not your own, your life is not your own, your patients are not your own, right? You're seeing other people's patients, and also there's a steep learning curve. So you're constantly being informed of what you're doing incorrectly in an attempt to educate yourself. But it really, it can take its toll on your confidence, which then takes its toll on your well-being. And so one of the things that was implemented when I became a resident was the 80-hour work week, right? In any fashion, I'm sure the 8-hour work week is still considered obscenely high, but there were doctors that were working, greater than, or at least in the hospital for more than 80 hours a week. So when we limited our hours, or at least as residents, did that have an impact on the rate of burnout in residency? And if it was that we used to work more and now we work less, why didn't burnout go away during for residents? So my sister-in-law, when she was a general internal medicine fellow at Hopkins, wrote a paper on, I think she wrote it, maybe it was under her maiden name, Lauren Gold, maybe it was under her married name, Lauren Block, but she wrote a paper that received a significant amount of publicity because she tracked the amount of time that internal medicine residents were spending doing different activities. And it turned out that face-to-face time with patients was I mean, I don't want to say it incorrectly, but like somewhere between 8 and 15% rings a bell. But whatever it was something that was definitely noteworthy because of how much time they spent filling out discharge paperwork and things like that, and how much time was spent actually with physical
Yeah,
with patients.
and that's exactly it. Yeah, there's no sense of I went into medicine to fill out papers. No one ever said that.
So so if there are any med students listening, not that this should dictate their decisions, but rather inform their decisions, what specialties tend to have higher burnout rates? And are there any specialties out there that would seem counterintuitive to you, given that, you're saying we need to be fulfilled. That's how we one of the major ways that we combat burnout is by making sure that we feel what we're doing matters. So what are the ones out there that tend to be the highest, and what are the ones that you would take you by surprise?
Yeah, so a recent survey I looked at just this last week, it said urology was number one, neurology was number two, and physical medicine rehab actually number three. And then it's followed by, what you would expect, your primary care, your emergency room physician, and general surgery. So that's kind of the top of the list. And I was shocked to see my specialty, physiatry, at number three on the list because, you know, I would say, we're not, nothing we do or very infrequently is anything we do life and death. So, we may not get as many calls. I think, again, it just comes back to, some of these specialties that, you go into it expecting one thing and you realize, you're doing a lot of other things. Like, for us, people come in and they want disability forms filled out. They want their DMV to get their handicap placard for their car filled out. And a lot of the stuff that you're doing, that is, administrative or paperwork, and it's not satisfying. And the same thing with radiology. I don't think many people would expect that to be in the top half of a list of burnout specialties. Um, but again, even them, there's a lot of radiologists that are burned out now too.
Yeah, actually, I just had a conversation with Sanj Kachel, who wrote a book on positive psychology, and he's a radiologist. And it seems that even though it seems, they do well financially, they don't get a lot of middle of the night calls. They're they're so distanced from the patient care that they lack that fulfillment. So he actually had some strategies to help combat that. But I think that seems to be the refrain here. That if you're in PM&R and you're just filling out forms for disability and workman's comp, and you're not going to feel fulfilled. And it seems like compensation does very little to mitigate that, or at least a lot less than you would expect.
And that's surprising. A lot of the people who've done these studies, they were surprised to find that out. It didn't have anything to do with how much or how little you made. If you're filling out the same form, and you mentioned work comp. I used to do a ton of that. That was kind of my bread and butter when I first started out because because nobody else wanted to do it at the time. You put everything in your note. You dictate your assessment, your plan. Work comp, at least in Florida at the time, you had a separate form that you filled out where you put down again everything you found on your physical exam, your assessment, and then your diagnosis, and then your plan, what you had ordered. And then you wrote on your prescription the medication you ordered again. So you're writing the same thing 3 times just to meet different people's requirements. And then, yeah, I hate to say it, but it doesn't take a medical degree to be able to basically photocopy something down. Yeah, it just gives you stress and carpal tunnel. And that was about the gist of it.
Which, being in PM&R, you're able to diagnose
I
pretty
could
easily.
treat, yes, there you go.
So what are some of your higher yield recommendations from the book? Let's try and find some action items for our listeners that take like the least just to kind of dip their toe in the water and give them a taste for what you provide in the book. So least time and effort that are going to have the biggest impact, so they get them started.
Yeah. And I think most of the things I've wrote about really aren't, they're not time intensive to do, or they don't require a big change. It's little things, if you can save, you know, 30 seconds each patient encounter and you have 20 patients you see in a day, well, you save 10 minutes that day. Over the course of a week, that's an hour, which, you add that up and you say you work 50 hours a week, take 2 off, or 50 weeks out of the year. you know that's, you've substantially increased the amount of free time, or time that you've got to do other things, even just making that 30 minutes a day difference, if you can add that to your day. And so, the top thing that most physicians complain about is the electronic medical record. We The number one cause of burnout everywhere you look has to do with charting and bureaucratic tasks. So if you can find ways to make your EMR your ally and not your enemy, that's going to go a long way to reducing burnout. So another thing to realize is there's no perfect EMR system out there, because I've gone through this with tons of physicians, and they're like, well, maybe I need to switch to this one or that one. Well, no matter what you do, you're going to run into the same problem. And that is that someone who has no medical education, not a clue about what it takes to interact with a patient in the room, writing the software that you're now using and being forced to squeeze into how we practice. So, you know, find ways to work around and within the system as much as you can. And so for me, templates are a lifesaver. Everything that I do, if possible, is templated to the nth degree. And that can be not just your patient notes, not just your op reports. It can be letters to referring physicians. It can be letters to patients. It can be, my specialty, letters to case managers or attorneys. Just anything that you write more than once a day, you really must have that templated somewhere. If you write it more than even once a week, I still would do a template for it just because it saves you so much time to do it that way. You may not think that it's a lot of work to dictate another 60 seconds each time, but again, those little minutes here and there add up. Um, use technology as your friend. There's ways that you can combine the standard template along with voice recognition. It's one of the things I did early in my practice, and I combined the two. It actually sped things up so much because you're a lot of people know you can't template every single possible thing there is. Um, so being able to say dictate a history, point and click for the physical exam, point and click for a diagnosis, point and click for your assessment and plan, and then maybe free dictate a sentence or two that specific to that patient. It makes it go much faster than typing. We talk faster than we can type. I've used voice recognition when I was writing my book, even just because I have a thought in my head. If I don't get it down fast enough, the chances are it may leave before I get it written out by hand or even typed out. So using that to your advantage, make technology and your electronic medical record your friend. Don't look at it as an enemy, as something to struggle against.
Yeah, I use Dragon, and I'm certainly not playing here, but I really, it helps me. One, it helps me connect with my patients a little more because they'll tell me their story, and then I will dictate it in a more succinct way, which really helps them understand what they're experiencing. Particularly when patients come in with sinus problems, that may not be sinus infections or dizziness, which is always very complicated to wade through. Hearing it back themselves with in a succinct way can help them understand their symptoms a bit more. And then I dictate the plan. I dictate the whole plan for most situations because then they get to hear the plan at the end. So rather than me telling them what the plan is, I dictate the plan. They hear me doing it, so I don't do it in such a rapid fire way. And then they get an opportunity to ask questions. So I've saved myself a step there. I do have some templated plans, but I definitely what I need to do based on what you're saying is I need to take a day off. I need to take a day off and I need to sit down with someone who knows my EMR really well. And I need to find as many ways as possible to maximize the macros and the templates. The caveat being, though, things like carry forward, there is a huge legal liability there. So you always need to watch out for things like that. If there are contradictions, be your review of systems and your history of present illness. Now your documentation can't be trusted as much. And so those are always things that you need to be cognizant of. But I definitely need to take a day off because it will make a huge not a day off, a day to maximize my EMR or a half a day. Because you're right, it is going to make a huge impact. As much as you may not like the EMR, don't hate the player, hate the game.
And
You got
that's, yeah,
you
that's
have
what
to
we're
find
in.
a way to, you have to find you're in it. You can't scribble your notes on a note card anymore. Those days are past. Yeah, you have to find a way to embrace it.
And really, especially if you work for a hospital system, or they have people who that's their job is they'll come sit down next to you, walk through a patient encounter with you, and just see where it is that they can help you maximize your efficiency. And you're right, taking the time, it may seem like a burden at, at this moment. When you take the time and invest in getting to know your system frontward and backward, you're going to make up all that time in the end, because you're going to be so much more efficient. There'll be so much less stress. uh, you don't If you're taking two or three steps to do something that one of the EMR champions at your facility can show you how to do in one step, it's going to make your life so much easier. And really, that's what we're trying to do with this book is just find ways to make the most of your time so you can get back some of that. We talk about delegating, outsourcing. Whether you use your nurses and MAs to fill out forms or field phone calls, use a scribe in the room with you. outsourcing at home. If you want to spend more time with your spouse, connect with your kids, find someone else to do the yard work or clean the house. You don't have to do all those things. You just have to find someone else who can do it. And let's face it, they probably are better at it than you are.
Well, especially, you have to consider your income versus how much you're paying out, right? If you can drywall your own house, then but the amount that you make as a physician, that being said, post tax, right? And then
Hmm. Absolutely.
and how efficiently they do it and how much they cost and how well they do it relative to you. It's basically an economic decision. How much do I make an hour? How much do I pay this person an hour? And how well do they do it relative to how well I can do it? Or, unless you enjoy it. Some people enjoy the spackling, I guess.
Yes, yes. I can't say that that's one of my favorite things, but that's kind of one of the things I touch on in the book, and I actually break it down by if you make say 200,000 a year and you work 80 hours a week, like, what's your hourly rate? If it comes out to $100 an hour, just for a round number, and you can get the kid down the street to mow your lawn for 20 bucks and he gets done in an hour, why are you doing that unless you just really love it? Yeah, is there not something better you can do with your time? I would never have time enough to catch up on our paperwork and things. If you get caught up on your billing, you're actually making money during that time when he's out there mowing the lawn for you. You've got to; those things are where you are gonna make the most. Financially, it's not going to be doing those minimum wage type tasks around the house.
Yeah, being frugal is important and not spending money buying stuff that isn't going to make you any happier, which we've talked about in previous episodes. But outsourcing is going to free up time, which is your most valuable resource. So paying someone to do something that you would be doing is very different because you've just bought time. You have to, I think of these things in two different baskets. One is stuff, and the other one is time. And time is much more valuable than stuff.
That time is the most valuable thing we have. There's no resource greater. I mean, you can look gold, silver, Bitcoin, whatever you want. There's nothing more valuable than time. And when I work with people or coach them, I always tell them, I can find ways to make you more money. I cannot find ways to make you more time once if you're not willing to do some of these things that we're talking about. You're limited. I cannot create time. We can find ways to make your practice more efficient. You can see more patients. You can sell braces in the front end of your office. You can invest in stocks or real estate. You can make more money. You can never ever create more time though. And so that's one of the things that I focused more on in the book was how to get your time back, as well as your health. Things like eating well, exercising right every day. Those are kind of important things that was to me anyway. Your health and your time. There's nothing else more important than that, because you can don't have those two things, you can't give to anyone else in your life.
There's one last thing from your book that I want to talk about, and that's the legacy ladder. Can you just talk briefly about the legacy ladder?
Oh, certainly. Yeah, the legacy ladder was something I created to help my coaching clients reconnect with their dreams, to get clear on their goals. What is it that you want to get from your career? Because let's face it, when you're burned out, when you're stressed, when you don't feel like you have a sense of purpose in your life, it's kind of hard to get out of that rut. And that's where whether it's you're using the book or an actual coach one on one to get you out of that. That's where having an outside source helps, and that's really what the legacy ladder is. It's a ladder to help you get out of that rut, if you will. Yeah, and it looks at what is starts off the big picture. What's the legacy you want to leave with your life? Now, if we look at the big picture, what do we want to accomplish? It's much easier to narrow down to the specific things that we need to change, and we can get more clear on things that are really important to us and what are not important. Because let's face it, we always get asked to sit in on some meeting or be a part of a committee, or even outside of the hospital, like to be a board member for a charitable foundation, or a school, or your alma mater. But really, are those things helping you reach your goals? And kind of the next step is like, so you have big picture, what roles do you need to be successful in order to make that legacy a reality? I mean, you've got your role as a physician, which is important. I mean, you worked so hard to get there, but you've also got your role as as a spouse, as a parent, as a friend, as a leader in your community, and sometimes those roles compete. So you've got to be able to weigh, the value of those, and do am I living out my life according to what I say I value? And if my values and beliefs aren't lined up with the roles I'm taking on or the way I'm spending my time, then you're just going to get frustrated and you're not going to feel fulfilled with that. And then, kind of the next couple rungs down from that is, if I need to fulfill this, need to be in this role, what skills do I need to succeed within that role? So if your goal is to, become chief medical officer at your hospital, then you're probably going to need to learn some leadership skills. If you want to give presentations on your area of expertise to further your academic career, to attract more patients, then developing your public speaking skills is important. For me, I've written a number of books and I've been a speaker and I've done coaching. Um, you know, but really, writing was the only one that came naturally to me. That was kind of one of my innate strengths that I had. Now, speaking took more time and more effort, to master the techniques to be able to communicate effectively in either a 10-minute time block, a half-hour time block, or an hour time block, depending on where I was at. So, again, do you have the skills to succeed, and do you have the habits to be successful? This is kind of what we talk about in the book too. Is you know, managing your EMR, managing your to do list by delegating or outsourcing. Uh, are you taking care of yourself, sleeping right, eating right, exercising? Do you have the right habits in order to be successful? I think further, kind of at the bottom of that list is really, are you in the right environment to grow? If you're, you know, unfortunately, a lot of doctors think that this is the place they want to start, and that's it's good to consider your environment, but it's really kind of the lowest level. You can succeed no matter where you're at if you have the right habits, the right skills, and you're putting yourself in the right positions. But if you're not addressing any of those things and just looking at, I'm going to change my environment, a new job is what I need. Well, unfortunately, you're going to take a lot of those same attitudes and skills or lack thereof with you to your next job or your next institution or your next, unfortunately, for some positions, relationship, your next marriage. You got to fix those things, and you can't do that without kind of going through the steps of this legacy ladder to see where you want to end up at the end, the end of your career, the end of your life. What do you want to do? Where do you want to be? And I think that doing it this way with the legacy ladder really is a much more efficient way of doing that. And it's worked for a lot of other physicians, and I highly recommend it to anyone who's kind of feeling stuck and feeling like what they're doing isn't leaving them satisfied or fulfilled.
I think that ties in well to the last question that I wanted to ask you. It was the thing in your book that I found the hardest to believe. And so, what position were you in that two people who play the French horn?
that that was just a coincidence of being in a very interesting medical school class. I had a couple of classmates who were music majors. One of them played French horn in college for scholarship, I believe, and she was quite talented. And another one of my classmates, he actually played the French horn as well. And we had a class choir, we had a class band, we had a class flag football team. We did, most of us anyway passed. We just had some very eclectic people in our group, and it was definitely fun to get to see all the different traits and learn about, what other people do to relax and unwind, because there's some things we may not think about, whether it's listening to a good podcast on your way to work, reading a good book or playing music. You gotta find things even outside of medicine that you enjoy and help you feel fulfilled in life.
Yeah, I think that's we need fulfillment in life. I think we need fulfillment in our careers, but also outside of the office, outside of the operating room, outside of the hospital. So it's important to have that type of balance. So some type of creative outlet, I think, is really important too. That's an excellent point. So, Dr. Christopher Burton, it has been a very interesting and very helpful conversation to me, and I'm sure to the listeners as well. So, where else can people find you?
The easiest place is just ChristopherBurtonMD.com. Please do the MD, otherwise you get to a luxury home builder in South Florida. Won't be helpful at all to you, unless you like luxury homes. But yeah, ChristopherBurtonMD.com. You can email me info@ChristopherBurtonMD.com. I'm also on LinkedIn uh, /Christopher Burton MD. So those are probably the best ways to reach out to me. The book is on Amazon available. If you get a chance to go check it out, I would greatly appreciate it if you could leave a review as well, just to spread the word, let other people know there are solutions out there. We talked about the consequences of burnout, and we don't have to go through that slippery slope. We don't have to go through it alone either. Whether it's a book or attending a lecture or having one-on-one coaching, there's solutions out there. Don't think that you have to face burnout alone.
Christopher Burton, MD, Burnout Breakthrough is the book. Thank you very much for your time. It has been a pleasure.
Thank you. Look forward to talking soon.
That was Dr. Bradley Block at the Physician's Guide to Doctoring. We can be found at physiciansguidetodoctoring.com or wherever you get your podcasts. If you have a question for a previous guest or have an idea for a future episode, send a comment on the webpage. Also, be sure to leave a 5-star review on your preferred podcast platform. Our show is produced by Gilfry Studios in New York City. You can find them at gilfrystudios.com. Our theme music was written by our show's producer, voice actor Carin Gilfry.